Good evening. My name is Laura Hutchison, and I'm the Chief of Public Affairs at the VA Palo Alto Healthcare System. I would like to thank everyone for joining us for our quarterly Veteran TeleTown Hall meeting. In just a few minutes, you will hear from our team, and following that, you will have an opportunity to ask questions. We have a full team of experts here this evening from our executive leadership team, business administration, community care, compensation and pension, pharmacy, social work, infection control, VBA, mental health, and patient advocates to address your questions. And today we have a special presentation from our pharmacy service. Please note we will be sharing different resources throughout this call, so make sure you have a pen and paper available to capture the information as it is shared. Screeners are standing by to take your questions. Press *3 to be placed in the screening queue. When a screener is ready to hear your question, you'll be briefly pulled from the event. The screener will take your question and place you back into the call. And given that we will not be able to take every question, we're going to read the questions this evening, so please listen in to hear when your name is called or if a similar question is asked. Again, press *3 to speak with a screener. Some rules of engagement. Please refrain from asking any questions that are specific to your care. For example, if you had a medical appointment or procedure that was canceled, we will not be able to tell you when that specific appointment can be rescheduled. We encourage you to contact your care team via va.gov or the VISN 21 Clinic Contact Center. The phone number is 1-833-983-0487. Again, that phone number is 1-833-983-0487. Out of respect for your privacy, we are unable to answer questions that are specific to your care. But again, if you have general questions or policy questions and concerns, we'll be happy to address them. We are sharing slides, so please head over to our VA Palo Alto Healthcare System Facebook page to follow along with us, or you can view the recording on our Facebook page after the call. And at this time, I will turn it over to our pharmacy team for their presentation. Catherine, can you hear us okay?
Yes, hello.
Okay.
Hi. All right, before I begin, where is the slideshow?
So we have it enabled. You should be able to see it on the top left.
Yes, I see it. Okay. Yes, I see it now. Okay. Hello, everyone. Good evening. My name is Catherine Hong. I am a pharmacy program manager in pharmacogenomics here at VA Palo Alto Healthcare System. And today I would like to talk to you about how genes affect medicines. Next slide, please. Okay. Everyone has some differences in their genes. And you can think of genes as a manual for your body. So it tells your body what the color of your hair is going to be, what type of proteins or enzymes to make. So genes carry information, a lot of information, and there are about 20,000 or more genes in a human body. So genes also carry information that may explain how you process certain medicines in your body. And with these differences in our genes, we know that people may respond differently to medications. Next slide, please. So what is pharmacogenomics then? Pharmacogenomics looks at a person's genes to understand how they respond to medications. So some people, when they start a new medication, they may respond very well without any side effects. When some patients might be responding it with mild side effects that are tolerable, And some patients might have very severe side effects where they have to stop the medication and consider switching to a different medication. And so through pharmacogenomics, we are hoping to choose a safer and more effective medications from the beginning so that this could help patients use their personalized medication. Next slide, please. You may be wondering whether you'll benefit from PGX testing. So there was an analysis on 6.8 million veterans using pharmacy benefits, and what we found from that analysis is that approximately 1 in 2 veterans are prescribed a medication affected by pharmacogenomics over 5 years. That's about 50% of our veteran population being prescribed a medication affected by pharmacogenomics. And approximately 1 in 10 will have a prescription modified by the test result in 4 years. So about 10% will have their prescriptions changed based on pharmacogenomics. And that's a lot of veterans who may benefit from pharmacogenomics testing. Next slide, please. So some potential benefits to veterans through pharmacogenomics is that it is a one-time blood draw test. Our genes do not change. We inherit genes from both sides of our parents, and one-time testing of these genes will not change over time. So it's a one blood draw that is done for this testing. And with the results from pharmacogenomics, potentially there could be less trial and error approach with medications. And the goal is to have fewer side effects based on selection of the medication based on the pharmacogenomic testing, which can also then improve adherence with medications because there are fewer side effects. Next slide, please. There are some patients who may not benefit from pharmacogenomics testings, and these are patients who have received allogeneic bone marrow transplant, which is a transplant of a bone marrow from another person, and patients who have received liver transplant. And the reason is because there may be a mismatch between the genetic information we get from pharmacogenomic testing and the actual enzymes or proteins that are in the body from the donors. So these are the only two patient population who may not benefit from pharmacogenomics at this time. Next slide, please. Some risks associated with pharmacogenomic testings include, from a sample collection standpoint, pharmacogenomic testing is considered low risk like any other laboratory testing because it is a one blood draw. There are some safeguards in place to protect our veteran privacy. The pharmacogenomic information stays within our VA electronic healthcare record system. And there are federal protection against discrimination when it comes to health insurance and employers. They are not allowed to use anyone's genetic information when it comes to health insurance and employment. The law is called the GINA Act. That protects from discrimination. However, GINA Act does not cover life insurance, disability insurance, or long-term care insurance. However, the genes that we test for pharmacogenomics testing, they're not the ones that we anticipate impacting these types of coverage because pharmacogenomics is not used to diagnose any disease or cancer. Genetic test results cannot be used to deny or reduce a veteran's service-connected benefits. So after having this pharmacogenomic testing, Our veteran service connection information and benefit will not change. Next slide, please. The medications that are impacted by the VA pharmacogenomic tests include some cholesterol medications that are commonly prescribed, and some blood thinners like warfarin or clopidogrel. And some other medications include agents that are used for heartburn, such as omeprazole or pantoprazole, and other medications like anti-seizure medications, some cancer medications, pain medications that include ibuprofen or celecoxib and tramadol, and some medications used for depression and neuropathic pain, and medications such as allopurinol for gout. Next slide, please. So how does the process work at VA Palo Alto? First, you want to talk to your VA provider about pharmacogenomic testing. You can ask your doctor, your nurse practitioner, PA, or your pharmacist, and see if pharmacogenomic testing is right for you. And if the shared decision is to go for the testing, provide your verbal consent to your provider so they can order the test for you. And once the lab is in, the order is in, you can go to any of our VA Palo Alto lab near you to complete a one-time blood draw. The pharmacogenomics results will return in about 2 to 3 weeks, and it'll be reviewed by the provider. And you can also obtain a copy of your full pharmacogenomics results through our medical records department. Next slide, please. As I mentioned, our pharmacogenomic testing is to really look at how you may respond to certain medications. It is not used to diagnose any diseases or conditions or cancer diagnosis. However, some genes on the test may identify increased risk for certain health conditions. And if this risk is identified, providers and patients will be notified and supported through next steps. And the next steps can include referrals to a specialist such as hematology or hepatology, or to medical genetics department. But again, the intention of pharmacogenomic testing is to get more information about how your body may respond to medications. Next slide, please. So if you are interested in getting this pharmacogenomic testing, I recommend that you ask your doctor or your pharmacist to order it for you. But please remember, do not stop taking any medicines based on pharmacogenomic test results without talking to your healthcare provider first. You may be on a medication that is impacted by genetic differences right now. However, if you're having, great results from it and you have no side effects from it, even though you have a different, may have a different genetic information on how you may respond to it, you may be able to continue the medication without any side effects. So please do not stop taking or making any changes to your medicines before talking to your healthcare provider first. And one thing to note is that pharmacogenomic testing is a free service offered to our veterans as long as they don't have a history of allogeneic bone marrow transplant or liver transplant. And next slide. If you have any questions about pharmacogenomic testing today, I am here for you. So please let me know if you have any questions. And thank you so much for listening.
Thank you so much, Catherine. So remember to press *3 to be placed in the screening queue. When the screener is ready to take your question, you'll be briefly pulled from the event. But don't worry if you aren't immediately pulled to a screener. Once you press *3, you are in their queue, and they'll take you in the order that they receive the request. And so, again, press *3 if you have any questions, and we will start to take some of the questions that we've received so far. So the first question actually is for pharmacy, so I'll give this question to Kelly, who's our Chief of Pharmacy. The question is from Dan from Monterey, and the question is the caps on all medications should be designed so that they can be written on. That way, veterans can write AM or PM or the order on the cap. When a doctor submits a medication and it's not approved, the patient is never informed, and this is a big problem.
Hi, Dan. Thank you so much for the comment and question. So for the first part of your question about the caps that are on the prescription bottles, so probably not a surprise to you, but the VA has a national contract with companies that make those prescription vials. So whether we fill the prescriptions at our local pharmacy or the mail order pharmacy fills them, those are a national contracted product. I think it's a great idea. So the best that I can do for this part is to bring this issue up with the national contracting folks to see if this is something that could potentially be changed. The other thing that I will do for this part of your question is speak with my outpatient pharmacy supervisors. Perhaps we in pharmacy can provide some labels that the veterans could use to put information on the top of their bottles. So once I have some more information about options of things that we can potentially do, I have your name and number, and I will have one of my outpatient supervisors give you a call to see how we can help. And then certainly if any of these things can change, then we would provide that information out to all veterans. The second part of your question about if a doctor prescribes a non-formulary medication, so a medication that is not automatically approved for use within VA, and it gets denied, that the patient is never notified. So I'm very sorry to hear that you've had that experience. That is absolutely what should not happen. When these non-formulary medications are reviewed and adjudicated, the information goes back to the prescriber, so the doctor that prescribed it, and that way they can make determinations if they have other alternative medications that they want to use, but they really should be communicating with the patient the status of this information. So I will have some of my folks go in and look at your profile to see perhaps if you've had some recent ones that might not have been approved for use, to get in touch with you and provide you with some specific information. But again, thank you for letting me know that piece of closing the loop is not happening, and we will work to improve that as well. So thank you.
Thank you, Kelly. The next question I will invite Lindsay Smith, who is our Chief of Community Care, to address the question. The question is from Sarah from Monterey, and Sarah's question is, what do I do about thousands of dollars I'm being billed from a hospital from community care? It was for IVF, and I worry they will destroy my eggs if I don't get them paid.
Thanks, Laura. Hi, everyone. This is Lindsay Smith from Community Care. Thank you, Sarah, for sharing this question with us. So you can contact us to work with you on this, and we can help address it. There are two ways you can reach out to us. One is our customer service phone number, which is 650-617-2732. Or you can send a secure message online using My Healthy Vet directed to community care. We will need to review these cases with you. This does happen sometimes where community providers will bill veterans instead of the VA, but we can intercede on your behalf. We can reach out to those community providers and inform them about what happened, and we can work with their billing offices to pull that back and bill the VA instead. Now, each case will be a little different because it does depend on whether or not the care that was provided was something that was approved and pre-authorized by the VA. And for IVF, it is a special eligibility program that is reviewed and approved. So we'll review that with you, and then we can then intercede and work with that community provider to make sure it's paid. Now, because this is a time-sensitive situation, I do have your name and phone number here, so we can also try to reach out to you to discuss this with you. So you can contact us, but we'll also try to reach out to you as well, since this is time-sensitive. Thank you.
Thank you, Lindsay. I'm going to give you the next question as well. The question is from Heiko from La Silva Beach, and the question is multi-part. So how do we qualify for care under the Mission Act? I have a block from chiropractor and acupuncture saying I don't qualify for community care. I was told to qualify for Mission Act, I would have to be either a 60-minute drive away, or no appointments available within 30 days.
Thank you for that question. So that is correct, but I can go over that here. So for the Mission Act, which is the national law that was established to help veterans gain eligibility to choose to receive care from a community provider instead of at the VA, it created qualification criteria, and those are correct for chiropractic care and acupuncture care. They use the determinant of 28 days wait for a new patient appointment. So if you're referred for the first time to those services by your primary care provider, if they cannot see you as a new patient within 28 days, then you do meet that wait time criteria to be able to choose to go to a community provider instead. Now, it is different for follow-up appointments. For example, if you have already been to this provider and you have a follow-up appointment and they say, we'd like you to come back in 2 months, that won't qualify you for the wait time eligibility, because for the return appointments, the requirements are that we see you when the provider would like to have you come back. But for the new patient appointments, it is that 28-day criteria. For specialty care appointments, it's a 20-day wait time criteria for mental health and primary care appointments. And that other one mentioned about drive time, it is 60 minutes for specialty care services, which includes chiropractic care and acupuncture, and it's 30-minute drives for mental health and primary care. Now, these driving times can be different all the time, of course, with traffic and where everyone lives and where the facilities are. So we actually use a tool that VA created in conjunction with Microsoft using the Microsoft Bing Map tool. So the VA system that we use will actually pull that information, and it won't always be able to tell exactly the appropriate minutes because traffic time changes all the time. So it is an approximation tool, but it will tell the staff whether or not you, based on your local home address, will qualify for the drive time eligibility for community care. So if a service has told you that you do not qualify for Mission Act either on wait time or drive time, they were supposed to have reviewed both the appointment timeliness to see how quickly you can come in, and also the drive time tool in our software system. Now, if you believe this is incorrect and that you really should be qualifying for community care, there is an official appeals process that would start with the patient advocate office, And if you do reach out to the patient advocate office and let them know that you have been denied community care as an option and you believe you should be eligible, they will be able to take you through that appeal process, and it will be reviewed by a higher level leader in VA, where they will be able to kind of look at that again and make sure the decisions that were made were correct. So if you do have those concerns, you can go to the patient advocate office. Thank you.
Thank you, Lindsay. I'll take the next question here, and I'll invite Lee Gapassan, our Chief of Business Administration, to address this question. The question is from Stephen from Hollister, and the question is, when we are trying to check in online for an appointment, it seems that the service is not working. I only get a working signal and have to check in with the clerk. It affects my mileage logging, and is this being remedied? So I know you can't speak to if there's system outages, Lee, but can you speak to how mileage is calculated for Benny travel and reimbursement?
Sure. Thank you for the question. Your ability to check in and the location where you check in for your appointment does not impact your mileage calculation for reimbursement. The way how mileage is calculated is based on your residence of record, and that residence has to be a physical address. It cannot be a P.O. box. And the way it is calculated is from that physical address to the nearest clinic or VA site that can provide that care. So if your nearest clinic that can provide that care is at the Monterey Clinic, it will be calculated based on the mileage from your house to the Monterey Clinic. Let's just say that service is not available and you have to receive that care at Palo Alto, then we will calculate it from your house address to our Palo Alto address. And the same goes if you receive that care in the community. We will assume that the nearest place that can provide that care is that community provider, and we will calculate the mileage from your home to the community care provider's office. So hopefully that helps explain how mileage is calculated, and hopefully you're, rest assured that where you're checking in does not play a part in mileage calculation. Thank you.
Thank you, Lee. All right. Actually, Lee, I'm going to give you the next question. It is from Wendy from San Jose, and the question is about Medicare. And so I'll read it as is, but if you can speak to how VA and Medicare work. So it would be great if the VA worked with Medicare. It does not make sense that they do not work together, and I have to pay out of pocket. Why can't they work together?
Thank you for that question. The Department of Veterans Affairs and Medicare, which is under the Department of Health and Human Services, are different agencies, and each agency receives different funding and funding mechanisms for the patients that they oversee. And that is one of the main reasons why we do not combine, because each agency is reimbursed differently for the patients. With that being said, for Medicare, one of the things that we do is if we are sending the care out into the community for a patient, VA does reimburse the community providers at the Medicare allowable rate. And also, once VA pays, the community provider does not balance bill the patients. They are legally not able to balance bill our patients. And the same goes with receiving care in the VA. We do not balance bill our patients either. So let's just say in your explanation of benefits, it says Medicare allowable is this portion, and patient responsibility is this remaining portion. VA does not bill that to the patient. The only bill that our veterans will receive is whichever copays they are required based on their income. So if they are, for example, a priority group 8 veteran, these are typically our veterans who require to pay a copay depending on the type of visit they are being seen for. VA will only charge the veteran either the basic copay or the copay amount for the specialty care, or if they were an inpatient, we will charge the inpatient copays. So that is kind of how we explain it, in where we do not balance bill these patients. So therefore, you will never receive that patient responsibility amount after the Medicare allowable rate. Hope that addresses the question. Thank you.
Thank you, Lee. The next question, I will invite Dr. Shah, our Deputy Chief of Staff, to address. The question is from Joanne from Palo Alto, and the question is, I need to see a podiatrist as I broke my toe. I tried to get an appointment and it was a month out, and I really need to get back to work. Who should I contact? My toe is still broken.
Thank you so much for reaching, Joanne, and I'm really sorry you've not been able to get an earlier appointment. So a couple of options. We have a same-day clinic where we can get you an appointment on the same day or the next day. But what we'd like to do is get your information and give you a call tomorrow morning so that we can get you an appointment as soon as possible. So somebody's going to get all that information from you, and we can go ahead and get you plugged in as soon as possible. Hope you feel better soon.
All right. Thank you, Dr. Shah. Let's see. The next question, I will ask I'll invite Lindsay Smith back to address this question. The question is from Marie from Santa Cruz. And the question is, I reviewed the community care criteria, but when I called the number to schedule a colonoscopy, I was told I was not qualified because they had tightened availability. Is there an appeal method in order to get this care?
Hi, this is Lindsay again. Thank you for that question. There is an appeal process, so this is some similar information that I had shared with the previous question, but this definitely would be a situation where there could be wait time eligibility. And so for a colonoscopy, this would fall under our specialty care requirement of being able to provide an appointment within 28 days. So if the service, if you believe that they did not comply with this requirement to offer you community care as an option, and that the wait time was longer than 28 days, then yes, there is an appeal process. So again, that as I mentioned before, it would start with the patient advocate office, and there would be an appeal process with them to make to have another neutral party review it to determine whether or not they complied with the rules. Now, I do have the patient advocate office phone number here also. I didn't share this previously, but I'd like to share this with you and any of the other veterans, where if you do have concerns about community care eligibility, where maybe a scheduler or one of the services told you don't qualify, but you feel like you do qualify, the patient advocate office, you may dial them at 650-493-5000, extension 65544. So they can work with you on an appeal if you believe that applies to you. Thank you.
Thank you, Lindsay. The next question I will invite VBA to address. The question is from Dylan in Mountain View, and the question is, what does the VA have for assistance for getting a change in rating for disability benefits?
Hello and good evening. This is Kenny Dyson here at the Oakland Regional Office here representing VBA this evening. Dylan, thank you for your question and most and moreover your military service. I would encourage you to come and visit us here at the regional office. You can visit us in person. You can bring your disability application or ask questions with one of our public contact representatives at the Oakland Regional Office. They're at 1301 Clay Street in room 1200. Or if you're over in the Sacramento region, you can come visit us at 3046 Prospect Park Drive. There you can meet with a public contact person in person, face-to-face, get an interview, and they can assist you in getting your applications submitted for any increases or new disabilities that you may wish to submit for. Additionally, veterans seeking assistance from our public contact team can also do so virtually. And we encourage them to visit us virtually or in person, but you can do so by scheduling a VERA appointment. That's VERA, and that can be found simply by just Googling VERA appointment, and that'll be the first thing that comes up for the VA, scheduling that appointment. And then we can meet with you in person and provide that, or in virtually and provide that assistance. And lastly, I would encourage all veterans to meet with a VSO representative, AMVETS, DAV, CDVA, VFW, any of those accredited representatives that can assist you and get down into the meat and potatoes if you have a particular disability or specific issue that you have to address within your claim. I hope that answers your question, Dylan, but if not, please feel free to come by and visit us here at the regional office and we'll get that answered for you. Thank you.
Thank you. The next question I'll invite Tyler to address. The question is from Jesse from Salinas, and the question is, how do I go about getting immediate help for not getting evicted and homelessness? Currently very close to being evicted. Where do I go to get immediate financial help?
Jesse, this is Ty Sussex from Social Work. I'm sorry to hear about your situation. There's a 24/7 national hotline at 877-424-3838. Again, 877-424-3838. They will do an intake assessment, talk to you about your situation, and get referrals started. They will also connect you with a local representative in your area from one of the local VAs to start working with you on different housing resource options. That number one more time is 877-424-3838. Thank you.
Thank you. The next question will take us from Kathy. I will invite VBA to address this question. Kathy from Monterey. The question is for compensation and pension. After an appeal is done and expedited and judged upon, why does it take so long for the VA to notify the veteran?
Hello, Kathy. This is Jaime Alicea. I'm the Veterans Service Center Manager for the Oakland Regional Office. Great question. I'll just get right to it with you. The board understands that veterans and appellants, they wait a long time for decisions. And we acknowledge across the spectrum that the wait can be extremely frustrating. I will say that appeal wait times have been reduced tremendously over the years. But the board recognizes that each and every case has a unique set of facts and circumstances that the judge has to carefully evaluate, appropriately resolve, according to the governing laws and regulations. So even after an appeal is completed and judged upon, the VA compensation and pension process can take months, mostly because the case has to go through multiple layers of administrative processing, recalculations, and even quality reviews to make sure that we're putting out the best product and preventing errors and making sure that you get the best possible decision. So the main key reasons for appeal delays are going to be rating adjustments, calculations. Again, I've already spoken to the quality assurance element, back pay authorization, dependency updates, and just the award generation can sometimes create a delay. So great question. I would encourage you, if you want to manage and check the status of your appeal, you can do that via va.gov, the va.gov portal, and it's as simple as Googling or using a platform to just type in va.gov, do the search. It'll come up with the appropriate website. And if the delay is unusually long, we encourage you to contact the VBA directly, and that number is 1-800-827-1000, 1-800-827-1000. And if you have a service organization rep, we're always putting a plug for our service organization reps. They're not specifically the Department of Veterans Affairs, and we have a ton of mechanisms for you to get a hold of us. But service organizations have the ability to go in and either make a request for an update to the VA directly, or they have the ability to go into the system and see what the status update on your award process is. So again, great question, Kathy. I hope all is well. Have a good one.
All right, thank you so much. The next question, actually there's two, and I will ask Catherine from Pharmacy. The first one is from Stephen from Sunnyvale, and the question is, with the pharmacy and genomics, does this apply to the A and B drugs?
Hi, yes, great question. I'm assuming the A and B drugs are referring to generic and brand names. So pharmacogenomics will apply to both generic and brand, but what's more important is that the genes that we are testing that are included in our pharmacogenomic testing, they are studied and known to affect the medications. So the genetic panel that we test, they do not affect or have been associated to all drugs out there in the market. There are certain drugs that have shown to be affected by these genes. So we are only applying it to medications with evidence that have been published in the literature. So it does not impact all drugs, but only the select known drugs based on clinical data. But if the medication has both generic and brand, yes, it'll be for both.
Thank you so much. I'm going to give you the next question as well. And this question is from, let's see, from Sherry. Thank you so much, Sherry. If someone does the genetic drug test, does that benefit their children? Are these things hereditary, or will children have different results?
Another great question. So while pharmacogenomics testing is not used for diagnostic purposes, some of the genes included in the panel do overlap with identifying risk for certain conditions, such as G6PD deficiency, which is associated with severe anemia. Also malignant hyperthermia, which is associated with certain anesthetics for surgeries or for emergency situations. So some of the genes can tell us about whether our immediate family members are also impacted. So not all of the genes, but yes, there may be some incidental findings that can help find out about your immediate family members.
Thank you. And there's actually a request if you can say pharmacogenetics again, if you can actually spell it out as well.
Yes, of course. Pharmacogenomics is spelled PHARMACOGENOMICS. Pharmacogenomics.
Thank you so much. Okay, the next question is from Morris from Soquel, and I will actually address this question. And the question is, why hasn't the VA in Palo Alto stopped employees from parking in patient visitor parking? I would like to speak with the VA representative in person or on the phone about this issue. And so, Morris, I do apologize that this is a continuing issue. I assure you that this is something that we are actively working on. Even just today, actually, we have asked our police, our VA police, to be more present in those forward-facing parking lots to make sure that they are enforcing and reminding our staff that they are not to use those two parking lots that are in front of our main campus. And so again, we've asked our police to do so more frequent, have more frequent presence there. We are sharing reminders with our staff regularly. We'll be sharing another reminder again. We'll make sure that we continue to do that. We are also working with our facilities management team. We do know that there used to be those parking barriers that they've since been removed, and because of that, it's easier for staff and really anyone to just park in the lots, and they are missing the signage that says that it's patient-only parking. And so, again, we are working with our facilities management team. There will be some new signage placed. It does take a bit of time to do permanent signage, but we are working on temporary signage in the meantime, and those should be placed in the upcoming weeks. We are hopeful with this increased presence of our VA police, with the signage and with more frequent reminders that our staff will discontinue parking in those lots. And again, apologize for any difficulties that you've or others have experienced while parking in those lots. Again, Morris, thank you for bringing the concern to us. Let's see. The next question, let's see, that we'll take here. There are a couple, but it is from, and I'll ask our clinical team, or this might be a combination response, but it's from Julio from Gilroy. And the question is, how does the VA treat type 1 diabetics, and what types of methods do they use?
So Julio, great question, and so there are lots of various treatment options. It could range anywhere from oral medications to insulin, and basically you have to be evaluated, and your primary care provider would help set up the treatment. And if they need specialized care or consultation, they will ask the endocrinology team to evaluate you and start the treatment protocol. So there is not one particular medication that they use. There are various options available.
Right, thank you. All right, the next question. Let's see here. I'm likely going to invite our VBA partners to address this question. It is from Gabriel from Seattle. And the question, it's two parts, and so we may need to follow up separately on appointments, but there's a question about Calvet, so I'll read both here. My father has a social worker, and I noticed that none of her appointments were on the VA portal, which seems unusual. And also the second part is the Calvet system is a separate state program, and do they work with the VA?
Hey, this is Kenny again with the Oakland VBA. I'd be happy to take the second part of that. Sounds like the social worker question is going to be more directed towards VHA. As far as CalVet is it's a government agency, which is actually known as the California Department of Veterans Affairs. It provides local, state-level benefits, housing loans, and support services to military veterans and their dependents. It administers programs like the CalVet College Fee Waiver for eligible dependents, and also well known here in the state of California is the CalVet Home Loan. They are much like a VSO. They have service officers there that can help you file your disability compensation claim and or pension claim or these additional benefits. But they work in correlation with the VA on a state level for you to access your benefits. Thank you, Gabriel.
Thank you so much. And Gabriel, for the first part, for the appointments not being in the portal, we have taken your information and we'll follow up to see where we can view those appointments if they're not showing online. All right, let's see. I know we have a couple of minutes here. I'm going to invite Lee Gapassan to answer this question. The question is from William from San Jose, and the question is, I have Medicare coverage and a supplement coverage through AARP. If I lose my supplement, will it impact my payments to the VA? The insurance rates are so high, I cannot afford it.
Thank you for that question. As I said in a previous question and answer, the VA only bills the patient the VA copayment that is required by the patient based on their priority group. So if the patient does have a required VA copay, the impact it will be if you drop your supplemental coverage is you will lose the ability for VA to reimburse you your copayment portion. So the way it works is when we bill your supplemental insurance and they provide us the reimbursement, if, for example, if you have a $15 basic copayment for that visit, if we billed your supplemental and they reimburse us $15, we will use that $15 to reimburse your account for that date of service. So if you have already paid, we will reimburse you that amount. If you have not paid for that copay yet, then we will apply that payment from your supplemental insurance and reduce your copay requirement based on the reimbursed amount. That is the only impact. So if you are a veteran who typically does not have any VA copayments due to your priority group, if you are in a higher priority group, then there will be no impact. So therefore, it will only be an impact for those veterans who do have a VA required copay. Hope that answers the question. Thank you.
Thank you, Lee. And we are almost at the end of our time, so we might have time for one or two more questions here. But the next question, I'll invite pharmacy to address the question. It is from Gilbert in San Jose, and the question is refills that require me to phone in each month. My doctor won't authorize continuous refills. When I request at the pharmacy, there's no response whether or not the doctor has responded. Can I get a notification or follow up to update me on the status of a refill?
Hi, Gilbert. Thank you so much for making us aware of this. I will have one of my pharmacists call you tomorrow to look into the medication that you're referring to. There are some medications that refills are not allowed, and every time need to be assessed by a provider. And so we just need to have one of our pharmacists talk to you to get more information about what medication you're referring to, and to help you try to get it resolved as soon as possible. Thank you for the question.
Thank you so much, Kelly. Let's see. The next question, I may ask our VBA partners to address this question. It is about disability claim percentage. And the question is trying to appeal my claim and look at more coverage for disability claim percentage raised. How can I get this raised? And it's, apologies, the question is from David from San Jose.
Hey, David, Kenny Dyson here at the Oakland VA Regional Office. Thank you so much for your question, and moreover, thank you for your service. There's many ways that you can file a VA disability compensation claim or disability appeal. You can do so by going to va.gov. That's our website there, logging in there and submitting either that new claim, that increase, or that appeal, whichever you choose to do. You can do so by mail. You can file your claim by mail using the application Disability Compensation for Related Benefits 526EZ, or if you have a supplemental claim to appeal a decision, the 20-0995. You can mail that application into the Department of Veterans Affairs. I'm not going to rattle off the address here because that'd be kind of a lot to write down all of a sudden, but I will get that information added for the intake. But you can also, moreover, come visit us at the Oakland Regional Office in person or virtually. You can schedule an appointment through Vera by simply Googling Vera VA, VA Vera, VERA appointment. And you can schedule an appointment virtually, or you can come see us in person at the Oakland Regional Office, 1301 Clay Street, room 1200. Or if you happen to be over in the Sacramento region, you can stop by our office in Rancho Cordova, located at 3046 Prospect Park Drive. Also, as the service center manager spoke about earlier, we always like to plug our accredited representatives because they are the best experts to help with these types of issues. So if you can reach out to AMVETS, DAV, CDVA, or VFW. And fortunately, we have all of these organizations available in-house at the regional office where you can stop by their office for in-person assistance if you'd like. I hope that helps answer your question there, David, but if not, please let us know and we'll get back to you. Thank you.
Thank you so much. We are at the end of our time, but there's one question here from Peter from San Carlos. And the question is, how do we get a copy of the slides that were presented? And so, Peter, we do have our town hall. It is recorded, and it is on our VA Palo Alto Facebook page. You can view the recording as well as see the slides that were presented. And so we recognize that we are not able to address every question, but immediately following this event, you have the option to leave us a voicemail. Please provide your first and last name and your question. But again, if you have specific questions regarding your care to reschedule appointments, we ask that you contact your care team via va.gov or the VISN 21 Clinical Contact Center at 1-833-983-0487. And one more time, that phone number is 1-833-983-0487. We also would like to take this opportunity to invite you all to attend our America 250 event. These are events that are occurring all over the country throughout the month of June and July, but we will be having a special event at our VA Palo Alto campus on Sunday, June 7th, and we are really excited to partner with the Santa Clara Valley Model T Ford Club for their 55th annual endurance run and lowland tour, and so it's really fun. All of the vehicles will be there. They then do a historic 150-mile ride We will have a resource fair, lots of information, music, and some light refreshments. We are also partnering with VBA, so our Veterans Benefits Administration will be out there as well. So again, it'll be a beautiful Sunday, June 7th at our VA Palo Alto campus. It does start at about 8 a.m. there, so you'll get to see all of those vehicles throughout the day. So thank you everyone for joining us this evening. Stay connected with the VA Palo Alto Healthcare System on the web, where you can sign up to receive email updates and link to follow us on Facebook, X, and Instagram. Thank you and have a great evening.